My name is Christian Ocampo. I'll be doing my video validation for personal protective equipment for my Nursing's Foundation course, Section 602 for Professor Hayes. So today I'll be showing you how to wear an isolation gown, a mask, and a pair of gloves. So before I begin, I just want to make sure that you should always wash your hands before doing any of this stuff. So for the purpose of this demonstration, let's just say I wash my hands. Start off, begin by the gown, grabbing it by the shoulder or the collar and having it droop down to the floor. Then I'm just gonna wear it like so, one arm through one sleeve. I'm trying to be careful here because these are a little thin, they're prone to ripping. Okay. Once I'm satisfied, I'm just going to grab the strings that are found on the shoulder blades and I'm going to tie them. I'm going to start with my neck first. And then next, it's going to be my waist. Okay. Now that I'm satisfied, quickly check to make sure I'm covered on my back. If I do have someone with me, I'd probably ask them to check my back for me, but I don't have that right now. Next, it's going to be my mask. So first, because I'm wearing glasses, I'm going to have to lift up my glasses and then pinch it first, Make sure it's, I get a crease. And I guess my glasses can hold the mask in place. And then I'm going to start with the top half of my mask, like so, and then tie it real quick. Now, depending on whichever clothing that you may be, these equipment will vary from place to place. Alright, now that I have my top half secure, I'm going to make sure that this is covering down to the bottom of my chin. And I like to have it overlapping, just like this. Then I'm just going to tie the bottom half to keep that in place. Okay, once I'm satisfied with that, we begin with the gloves. So, these are just your standard gloves, Make sure you double check if the patient has any allergies to latex. That can definitely change what kind of glove you'll be wearing. Now, as for the gloves, you want to make sure that it's over the gown, and you'll see why later. I have big hands, so I don't have that much clearance. Alright, that's the right hand now. Next is the left. I'm gonna make sure everything's covered. Great. Now that I'm done taking care of my patient, now at the door side, I gotta take this off. So for starters, let's start with the gloves. Gotta take one glove and pinch it, and I'm gonna pull away from my body, just like so. Right? Then I'm gonna ball it up and make a fist. Then using my clean hand, I'm gonna reach right where my glove goes over my gown and I'm just gonna try and get my big fingers underneath. And then once I have that, I'm just gonna use my fingers as leverage to push the gloves off my hand. Now you see how like the dirty glove is now contained within the clean glove? That's the reason why, you know. Now, I don't have a trash can, so I'm just gonna set that there for now. Next is gonna be my gown. I'm gonna start at my waist. Just gonna undo this knot. Okay. Gonna be a bit hard. Okay, that's done. I'm gonna let it droop. Next, for my top half. Okay. Then I'm just gonna let it droop. Now using my clean hands, I'm gonna actually scoop and peel away my gown off of my body. So I'm gonna start off right here. And I'm just gonna do something like this. One. Alright, and then the same thing for the other side. No. Two. Then I'm just gonna roll it up. The inside of that gown is now facing me. Alright? Once again, I don't have a waste basket, so I'm just gonna set this over here. Next is gonna be my mask. Just gonna do the mask, just like so. And then I'll dispose of the mask as well. Then after that, hand hygiene. Just wash my hands, and I'll be doing whatever I need to do. Thank you.